or to subscribe to our weekly e-newsletter, please visit our website, heartbeatradio.org.
Next time on Philosophy Talk, is postmodernism really to blame for post-truth?
Yeah, postmodernism made it respectable to deny sensible ideas, like truth and fact.
No, it didn't. It just said when you think about those ideas, you also have to think about power.
Yeah, but that's what led to today's alternative facts and fake news.
Oh, don't blame postmodernism for that.
Postmodernism and post-truth. Next time on Philosophy Talk.
Listen to Philosophy Talk today at noon on KSJE 90.9 FM, Farmington.
COVID-19 cases are high and it's overwhelming our healthcare system. The caregivers at San Juan Regional Medical Center need your help.
Our resources are exhausted. We're very limited on what we have the capacity to do because we're being overwhelmed with the number of individuals that are requiring ICU care at this point.
So what can you do to help? Most importantly, ignore the rhetoric and get vaccinated.
Continue hand washing, continue to wear your mask and social distance.
Help us so we can help you.
Ten minutes past 8 o'clock. It is Tuesday morning, the first day of March 2022. Good morning, everyone. I'm Scott Michlin, and thanks for tuning in to KSJE 90.9 FM over the air, of course, here in San Juan County, New Mexico, streaming everywhere else on the planet from our website, KSJE.com. And we welcome our viewers who are watching this visual radio program. It is streaming live this morning out to the KSJE Facebook page, our YouTube channel, and our Twitter account. So welcome aboard, everyone. We are glad that you are with us because coming up this morning, it is our monthly commitment to CHIC, the Community Health Improvement Council of San Juan County. We bring a guest on every month representing CHIC, and this morning our guest is going to be talking with me about substance abuse and treatment for substance abuse here in San Juan County, so we hope you'll stay tuned for that, for the very latest information. Later on this hour, of course, on Tuesdays at 8:50 a.m., we check in with Amber Francisco from the Farmington Regional Animal Shelter. She'll be talking about some of the pets available for adoption this week, including Bruce, the good-looking dog you see on the screen right there. So we'll tell you more about him later on this hour here on KSJE. Next hour, Mick Hess will be here roving with the arts, and this morning on our classical music program, Mick is featuring two great composers, of course, the great Haydn and also Klughard. You'll hear music from both those gentlemen coming up today on Roving with the Arts. Don't forget, in addition to Facebook and YouTube and Twitter, you can connect with KSJE on our Instagram page as well. And if you're a podcast person, well, you can subscribe for free to KSJE Podcasts. Wherever you listen to podcasts, you can find us everywhere. So check it out and take us with you and maybe catch up on some programs that you may have missed. Also, let's talk about the weather outside our studios. It is sunny this morning, 29 degrees in Farmington at the moment, and it looks like March is coming in like a lamb, at least for the first few days of the month. 61, mostly sunny today for the forecast. Clear and 24 tonight. It'll be sunny and even warmer tomorrow with a high of 65 degrees on Wednesday. Look at 68 for a high with partly sunny skies on Thursday, with overnight lows near 37 on Thursday night. Then Friday, maybe some showers in the forecast. Still mild, the high 60 on Friday. 36 overnight, maybe a chance of rain or snow Friday night into Saturday with a high of 53. Maybe some more chance of showers Saturday night into Sunday with a high of 45 and partly sunny skies on Sunday before things turn a little bit more March-like with partly cloudy skies and showers in the forecast for Monday even with a high of 48 degrees. Well, we will see if that moisture happens or not as we get a little bit closer to those that forecast. Let me turn to my guest this morning, as I mentioned, representing CHIC, the Community Health Improvement Council. Athena Huckabee is joining me this morning. She's the Community Outreach Coordinator with Ideal Options, and she is joining us this morning. And Athena, good morning. Thank you for joining me. Good to have you on the show.
Hey, Good morning, Scott. Thanks for having me on. It's nice to see you as always.
You bet. Good to see you as well. And just to bring folks up to speed, remind us, Ideal Options, relatively new to the community, although I know you and I have talked a few times now. I think it's our third time talking. But your organization deals with treatment for substance abuse, right?
That's correct. So our organization was founded in Kennewick, Washington in 2012, but we've been in New Mexico for about 2 years now, and we opened in Farmington. It was our second clinic after Las Cruces that opened. So for about 2 years, we've been in San Juan County, and I've been working with the Community Health Improvement Council, also the Substance Use Coalition, and other groups within San Juan County, just trying to network and improve things for everybody.
Right. Well, my apologies that you've been here for 2 years, and I thought it was more recent than that, but I blame it on the pandemic, so that's my excuse.
It goes quickly, Scott. It goes quickly.
Well, it's gone really long, but that's beside the point. But anyway, great that you are here. And you were telling me before we came on the air this morning that you've added some staff to your Farmington location, so I wanted to ask you a bit about that.
That was one of the reasons I wanted to meet with you today. I'm really excited to announce so our model at Ideal Option, we never run a wait list, and we always see people generally within 24 to 48 hours. So people can get help at one of our clinics immediately. We rely heavily on telemedicine to do that because we're located in multiple states. So some of our providers are licensed, let's say, in Arkansas as well as New Mexico. So they see patients in several different states. For the first time at our clinic, we have a local provider, and her name is Kelly Young. She's a family nurse practitioner. She's from the Durango area, and she started with us a couple months ago, doing credentialing and training and all of that, and she started seeing patients last week.
Gotcha.
So that's pretty exciting that we have somebody actually physically in the clinic to see our patients.
Right. But again, even if she was unavailable or what have you, you have other options too for folks, right? And that's kind of part of your plan and how Ideal Options is set up.
That's correct. But I also think it's so good to have somebody, a provider in the clinic. People just make connections better in person.
Right. Very, very true. And so, again, we were talking before we came on the air this morning, Athena, about the issue of substance abuse and opioids, probably the most devastating addiction that we keep hearing about, and it shows no signs of diminishing or going away. Right, the numbers are still really on the way up, increasing in the wrong direction.
That's correct. What we saw. We thought we were dealing with the worst that we had ever seen in 2019. Before the pandemic, about 75,000 people died of an overdose that year in the United States. When the pandemic happened, those rates just continued to climb. And so every year thereafter, we keep saying it's the worst year on record. It's the worst year on record. So last year, unfortunately, we saw in the United States 120,000 people or so dead from drug overdose. It's extremely unfortunate that it's a problem that we can't seem to find a good solution to.
Right, and it seems hard for folks to maybe beat that addiction too, and sometimes without getting help from places like yours and other available services. But it's just these addictions are really difficult to break sometimes, aren't they?
Yes, absolutely. And I think also that there's a stigma in the first place for having a substance use disorder, right? Just pull yourself up by your bootstraps, figure it out, make a change. It can be very difficult. There's some of the studies about stimulant use, methamphetamine withdrawal, for instance, says it mimics in your brain that your brain basically thinks you're dying, and it's doing anything it can to convince you to use, right? Because that's what's going to make your brain feel better in that moment. So I don't know if people really understand the depth of that. And then also there's a lot of stigma around getting help, especially if people choose to use medications like buprenorphine or methadone, or even some of the medications for alcohol. People will say it's a crutch. So I think we've got stigma on all sides.
Right. And hopefully that's going away a little bit. At least I think folks are maybe feeling more comfortable about seeking help and asking for help, or maybe even family members telling their family members that maybe they need to talk to someone about their addiction or things along that line. Do you see any of that happening?
I do. And I mean, that's one of the main things that I do in the community, right, is trying to educate around stigma and doing community development, trying to, move the needle on that and doing education around it. I think it can be confusing when families do get help because there's so many different types of help available, right? Everything from going to the emergency room to getting stabilized medically to going to something outpatient but intense, like intense outpatient treatment or an IOP or PHP, partial hospitalization, right? Then there's outpatient clinics like Ideal Option, and then there's inpatient clinics. Some of them use medication and some of them don't. So it's hard for consumers to educate themselves, I think. And I think that one of the things that we're doing in New Mexico is we're hiring a lot of peer support workers. And so they can help, families to navigate. Certainly caseworkers and things like that can do that too, but it's so overwhelming, I think, even when people do decide to get help.
Right. A lot of choices, and I guess a lot of folks trying to figure out maybe what fits best for them. It's really an individualized treatment, isn't it? Because each case is probably different, is it not?
It is. And there's different types of substance use disorders, right? Whether somebody has a problem with alcohol, methamphetamine, opioids, benzodiazepines, or several of those things. And then different things work better for different substances. And then, like you said, it's very individual. So substance use can present as mild, moderate, or severe. And so, of course, severe would need a different level of care than mild or moderate. So yeah, it gets pretty in the weeds pretty fast, Scott.
Right, right. Well, we've been talking a lot about and hearing a lot about opioid addiction, which certainly is in the headlines a lot, but certainly there are other types of addiction that you and your company work with, alcohol and other substance abuse and things along that line as well. And you were telling me about another plant that's now around that is also potentially addictive in nature. Can you talk a bit about more about that with me?
Yeah, absolutely. So the plant that I was referencing is called kratom, and I just pulled up a little blurb about it so I could explain it. It's a plant that's mostly native to Southeast Asia. It's unregulated. It's commonly sold in gas stations and online. It's marketed as an antidepressant, an energy booster, a pain reliever, and it is a legal herbal supplement at this time. So you can, you'll see it in Circle K at the counter or maybe in other types of convenience stores. When taken in high doses, kratom can produce opioid-like effects, and that allows the user to experience euphoria as well as a sedative effect. And since it works on the opioid receptors in the brain, the same receptors that morphine and heroin work on, it appears to have properties that expose users to risks of addiction, abuse, and dependence.
Wow. And of course, again, it's not regulated, and if used as directed, there really shouldn't be any worry, but that's where we get into the issues, right? There's a lot of things that when we abuse them, we're not using them as directed, and that's what can lead to this addiction and other potential health problems and things along that line, correct?
That's correct. So a lot of people seem to really benefit from kratom. People swear by it. I talked to a psychologist actually in El Paso that recommends it for his patients. So, professionals may recommend it. It's not FDA approved, even though it is legal, right? If that makes sense. So herbal supplements exist in this sort of liminal space where, it's not endorsed, right, by the FDA like a medication,
right.
but it's also legal to obtain. So it can work very well for some people, but then just like with substance abuse, right? Some people are very easily able to have a glass of wine here and there, and then some people develop a substance use issue around alcohol. And I think we see that same thing happening now with kratom. So for some people, they're able to take it as directed and it works very well. And for other people, they develop a tolerance and continue to increase their dose and then are taking large amounts daily and are having problems stopping. And the withdrawals are similar to the withdrawals from opiates.
Got it. And so if someone is maybe abusing this substance or any other substance, and maybe there's a relative, family member, good friend who maybe thinks that's happening, any signs that people could be looking for to maybe indicate that this could be not just a regular or more so than just a problem, not just a regular use of this substance, but more of an abuse of this substance?
I think that's a great question. I think anytime that I think about substance use disorder, I think about compulsion, obsession and compulsion, right? So thinking about the substance a lot, making a lot of efforts to go out and get the substance, spending a lot of time getting and using the substance, and spending a lot of time recovering from using the substance. So those are all signs. Also, any type of effect on social, work life, family life. So missing family events because they've been using or recovering from a substance, missing work, dealing with, missing things that they usually like to do, not hanging out with friends, being more isolated. I would say those are all signs that people could look out for.
Good to know. My guest this morning is Athena Huckabee. She is the Community Outreach Coordinator for Ideal Option in New Mexico. They have a clinic here in San Juan County. And Athena, you were mentioning earlier that Ideal Option is all kind of outpatient treatment, and that is what you do, not inpatient necessarily. And so does that give you a bit more flexibility, I guess, to help individuals, but does it limit also the types of folks that maybe can be helped by Ideal Option?
Sure. That's a great question, Scott. Thank you for asking. Yes, outpatient treatment gives people a lot of flexibility. So people are often concerned about going away for treatment because they have jobs and kids,
Right.
or they're going to school, or they have family members that they have to care for. So outpatient treatment gives people the option to come into the clinic, periodically. It's more frequent, of course, at the beginning of treatment than as people progress. But the idea being that you don't have to quit your job, stop caring for your family member, find somebody to take care of your kids. You can come in, see us, we'll prescribe a medication that can help with your cravings, and then you can sort of go about your normal life. So that's the idea. Like you mentioned, for opiate use disorder, these medications are extremely helpful right away. And people usually, the medication combined with some therapeutic support and maybe some other support can be really effective, even in an outpatient setting. Alcohol is a little bit more difficult. And if people are going through severe alcohol withdrawal, especially, that can be extremely dangerous, and people need to be in an emergency room or an inpatient clinic. We can deal with people on an outpatient basis with alcohol that are going to go through mild to moderate withdrawal, or who I would say have a mild to moderate substance use issue. So if it's severe, I would recommend people go to the ED to get stabilized, or go inpatient for a while and then follow up with us.
Got you. That makes sense. And I suppose, too, if someone were to come to you and your folks felt that maybe they needed more help than what you can provide in an outpatient situation, you could refer them someplace else.
That's absolutely correct. So another one of my big jobs is to maintain and make relationships with other organizations in the community. So I would probably actually give a call to the social workers over at San Juan Regional Medical Center and talk to them about whether they had a bed to be able to stabilize the person, or find out if the person wants to go inpatient and try to figure out how to make that happen. So yeah, absolutely. We have a lot of cross-referral relationships with other entities in the community.
Very good. Well, speaking of cross-referral relationships and networking, I did want to come back to the CHIC organization, the Community Health Improvement Council, because, again, you're a member of CHIC, and there's a lot of other great organizations that are members of CHIC. The whole idea is to kind of meet and share information and talk about community health and things along that line. So would you mind giving me some impressions when you all get together of how we're doing? Again, we're like everyone else. We're coming out of, hopefully coming out of a 2-year plus pandemic, and there are signs that things are returning to normal. Our hospitals are not under as much stress as they were just a few weeks ago. And so what are you hearing? What are you learning from your other CHIC colleagues that is happening these days?
Yeah, so it's a very well-attended meeting, and we've got partners from all over. San Juan County Partnership is who sort of really gathers everyone together. We're still meeting on Zoom right now. But I would say everybody's very optimistic and positive. We're all sort of working in our individual sectors to make change. And I think it's wonderful that we come together and talk about it, like you said, in this sort of holistic cross-referral kind of way, with each of us working in different areas. We've got, it's a really great group, and I'm excited to be a part of it.
Very, very good. And that's important as well. What does the future hold for Ideal Option? You mentioned, of course, the new provider who is here. Is there plans to maybe expand that, or what can you tell us? What's in the future?
Well, we have another provider in the pipeline, crossing my fingers. I won't give a lot of information about that person because they're still being credentialed, but hopefully we'll be bringing on actually 2 providers at the Farmington location. So that is exciting. We're also opening a clinic in Rio Rancho. That's set to open either at the end of March, beginning of April. So that's going to be our newest clinic location in the state, in Sandoval County. And then we're really recruiting providers for Roswell and Hobbs. So if people are interested in working in those communities, they should get at me. Okay, very good. And what is the best way to reach out to you or to find out more information about Ideal Option? Sure. Well, my work cell is 575-519-5055, and people can feel free to text or call me there. So that's probably the best way to get a hold of me. Ideal Option, I would say the best way to get a hold of us is electronically. So we have a really robust website. It does a lot of things. So there's idealoption.com/appointments, so people can request an appointment online. There's idealoption.com/refer, so people that are working in the community can refer a patient over to us. And we've got a ton of information. You can also use our contact us link, and that gets routed to the right person. So that's probably the best way to do that. There's also idealoption.com/careers. So if people are interested in coming to work with us, we've got quite a few work from home and remote positions, as well as provider and medical assistant positions in different areas. Very good. Well, Athena Huckabee, I really appreciate your time this morning, being with me. Thank you so much. Great to speak with you. It was so great to be with you again. Thanks for letting me on, and take great care. Have a great morning. All right. You too. Thank you very much. That is Athena Huckabee with Ideal Option, my guest as we dedicate our program to CHIC, the Community Health Improvement Council here in San Juan County. I'm Scott Michlin. This is KSJE. Back with more in just a moment. KSJE and San Juan College present the Student Success Coaching Tip of the Week.
Hello, this is Chi from the Student Achievement Center. This week, we're bringing you coaching tips of the week for week 7. Taking good notes. Studying starts in the classroom. Pay attention and take good notes. So when you're studying later, you're just reviewing information. Speak with your professor about recording lectures on your phone. A recording can complement your notes, so you can go back and re-listen to the information in case there are other details you pick up on later to note. Effective note-taking strategies can have a direct impact on your study habits and is one of the most important study tips for college.
The Student Success Coaching Tip of the Week, presented by KSJE and the Student Achievement Center at San Juan College.
How hard is it to regulate algorithms?